actually have units of blood, and we can set them up for transfusion for a patient. And right here we have fresh frozen plasma. This is used to correct coagulation disorders if a patient takes too much Coumadin, for example. This is how we actually thaw it. It's a 37-degree water bath. To actually do the testing for transfusion, we would do a blood type, an antibody screen, and a cross match. And this is actually how we do it. These are our gel cards that we use. And these are our reagents. So for a patient's blood type, we would use the patient's red cells for the A, B, and D reactions in the front type, and then we would use the patient's plasma in the back type for the A1 and B cells. And the front type and the back type should have opposite reactions. I don't have an example for you, but that is how we actually determine a blood type. Over here is immunology. This is where we do our kit testing. We do pregnancy tests. We do fecal occult blood, which tests for blood in the stool specimens. We do HIVs, monos, and we also do syphilis testing over here. This department over here is hematology. This is where we do complete blood counts. And we actually use the microscope to look at blood smears to look for red blood cell morphology and also the white cells. And we can do a differential on the different types of white cells. This is urinalysis. We do stick testing on the urine. And this will actually show the different things we test for. We do glucose, bilirubin, ketones, blood, pH, protein, and then we also look for white blood cells in the urine. We spin it down in the centrifuge here, and then we look at it under the microscope. This is our giant chemistry analyzer. We run about 100 different chemistry tests on this, including blood glucose. We also do sodium, potassium, chloride. We do cardiac markers to look to see if a patient had a heart attack. We also do amylase and lipase. So there's a nice variety of different types of chemistry tests happen over here. This is our coagulation analyzer. We have two of them over here. You can take a look inside. This is where we do ProTime, and we also do PTT testing. This is to see if a patient has a blood clotting disorder or if they've taken too much of the blood thinners. And then lastly, we have microbiology back here. This is where we actually grow bacteria. And we actually ID it, and then we have different sensitivities for the different types of antibiotics so the doctor knows how we can actually kill the bacteria. Here are some examples of different kinds of bacteria. So this is E. coli up in this top section here. Pseudomonas aeruginosa kind of has a mother of pearl sheen. And then over here we have Klebsiella pneumoniae. Here are some different types of staph aureus that are commonly called staph infections. This is strep pneumo. It most commonly causes pneumonia. Other ones. We've got strep A, which causes pharyngitis. We've got strep B down here in the corner, and then just another staph. So, that is the lab in the hole.